Hi, it's great to be here and challenge a few assumptions. In this session, we're talking about it's not what you think. So I want to push some thinking here. My goal is to convince you that we can do something that's actually pretty simple that can prevent hundreds of millions of premature deaths. Now, but the other thing about it's not what you think is that the solution to the problem involves dragons. Now, I've spent over a third of a century as a lawyer doing public policy work on public health. I think I've had a lot of successes. There are a lot of things that seem to get in the way. And as much as I learned about law and politics and advocacy and how to deal with the media and politicians, and I realized there was something missing. And it only came to me late in my career, which I think will surprise a lot of you. I didn't understand very much about dragons, and dragons were clearly the solution to the problem. So I had to put my entire career on hold to learn a lot about dragons. And that 5 minutes on Wikipedia was time well spent, because what I learned is that there's lots of different types of dragons. You know, there's the dragons that have literally shaped the architecture of this city. There's the dragons of power, the dragons of luck, you know, the dragons of wisdom, the dragons that literally impact our destiny by controlling things like water and weather. But those aren't the sort of dragons I've had to deal with in my career. What I'm talking about are the bad guy dragons, the evil dragons, the dragons that would burn down villages, they would destroy the crops, they would kidnap princesses. These are irredeemably bad dragons. And when you get an irredeemably bad dragon, you need a Dragonslayer, because that's all you can do. You can't negotiate with a dragon. When they're like that, you just have to slay them. Well, this is really critical in various ways, and we've heard from other people here talking about how our brains work, that we see danger very, very quickly, even if it's not there. Evolution prepared us to do that, because if we were wrong and there really was danger and we guessed there wasn't, then nobody would have lived long enough to breed and we wouldn't be here. So our brains are set up to do that. So there's this tendency to make these gut reactions, the fight or flight, the good guy or bad guy, seeing a witch, seeing a dissident, finding a dragon. And when you find a dragon, it's just like any form of evil, you end up finding more, because nobody ever finds a little bit of evil. If you're having a purge, you don't find just one dissident. If you're doing a witch hunt, it isn't a single witch. If you want a decent inquisition, you don't stop at one heretic. You find lots more. So this ends up affecting a whole lot, because you get into the area that I've tried to work in through my career, when I haven't put it on hold to read Wikipedia, that you get public health taking a really rational approach towards things. You try to meet people where they are, rationally deal with the problem, be really pragmatic. So with any cause of death, injury, or disease, what we try to do is 4 different things. Whatever's causing the problem, you say, what can we do to dissuade people from ever starting to do that? What can we do to get the people who are doing it to stop? What can we do to protect third parties from what they're doing? Things like drinking and driving laws. And what can we do to reduce the risk for the people who are still going to engage in the activity? That's it. The problem is when dragons get involved, because once you've got an enemy, once you've stimulated that deep part of our brain, you're no longer seeing a problem to be solved, you're seeing an evil to fight. And if you look at the history of public health, it comes up again and again and again. So even with really straightforward things like immunization, we've eradicated some amazing diseases. But it wasn't easy, because when you try to do that logical public health thing, stuff gets in the way. People see dragons. So you talk about immunization. What happens when somebody says, you're interfering with the will of God, or you're going to cause autism. They see a dragon. They're fighting the dragon. It's no longer about solving a problem, it's fighting an enemy. What happens when public health takes on the role of a dragon for things like during smallpox inoculation campaigns, some public health agencies managed to get police power. They could force people to be immunized against their will, because this is how we're going to solve a problem. The difficulty is the people started finding out that some of those vaccines were contaminated. They were causing death or injury. And the immunization programs are being run in ways that were clearly racist or class-based. So what happened? Dragon. People saw a dragon. There were riots against being immunized against smallpox. Dragons. There's other times where we look at a major health issue, and obesity is a good classic example. We see a problem, and we have a choice. We can use that rational part of our brain to say, let's think it through. What do we really know? What can we question? What more do we need to know? Let's keep judging this and deciding, are we doing the most efficient thing? Or we can spot a dragon. Fat was the dragon. We decided to slay fat. And when you're in a dragon fight, you don't have time to do other things, like listen to people or look at the research. You've got to fight a dragon. You're slaying a dragon. And they were so busy slaying the fat dragon, get it, fat dragon, that there was no time to pay attention to sugar. Sugar got a free ride. The obesity problem got larger. So you turn that to an area where I've spent most of my career in trying to deal with smoking-caused disease. And as background, cigarette smoking will have killed about 6 million people worldwide this year. By 2030, it'll be about 8 million a year. At current trends in consumption, the World Health Organization is estimating it'll be somewhere around 1 billion people in the next 100 years. Huge cause of death. But an interesting thing happened, and you know what it's going to involve. So starting about 60 years ago, as all this research started coming out about just how deadly cigarette smoking was, thousands of papers coming out over a period of decades. And the cigarette companies did an interesting thing. They decided, well, rather than logically deal with this and try to look at what we can do to reduce the risk for the people who are using the sort of products that we're using, why don't we hire lawyers and public relations consultants and deny it all? And we'll say we don't think it really does cause lung cancer or emphysema or esophageal cancer or oral cancer or heart disease. We don't believe it causes stroke. We don't think it's really addictive. Our advertising, hey, that doesn't affect consumption. Us want a young person to start smoking? You've got to be kidding. Of course. And what was the public reaction? What was the reaction of health advocates? It's simple. Dragons! They saw evil. And when you get into a dragon fight, of course, it is a fight to the death with evil. So anything that looked like a dragon had to be taken on. So it wasn't just cigarettes, it was the companies, it was anything they sold, any other form of tobacco product they sold, any nicotine product anybody else sold, because they were all dragons. And if you couldn't slay the right dragon, well, you could slay some other dragon. So you might not be able to get rid of cigarettes, but you get rid of smokeless tobacco or electronic cigarettes, or you could overregulate nicotine replacement products to make them hard for people to use, because darn it, they're all dragons. But while this was going on, and it's tremendous fun to be slaying dragons, there was this other thing happening, which was called science. And the science was telling us that the real problem here is the smoke. The reason that cigarettes cause all those diseases is because people are inhaling smoke. Our bodies aren't equipped to do that. If we got our caffeine by smoking rather than brewing tea leaves, same diseases. The reason 500,000 women in India will have died this year from respiratory illnesses caused by cooking is that they're doing it over an open fire. It isn't the cooking that kills you, it's the smoke that kills you. And we knew that there were ways that you could get your nicotine with very little risk. The Swedes have been doing it for a long time with a form of oral tobacco there called snus. The Americans have their forms of moist snuff. There's now things like electronic cigarettes. The Royal College of Physicians in the UK, after a major report earlier this year, said these products appear to be at least 95% less hazardous than cigarettes, and probably even less hazardous than that. There's things like heat-not-burn products that have gone over very big in Japan just in the last year, and it looks like about 1 million smokers have switched to these sorts of products. They get rid of the smoke. So what would happen if we do this amazing thing that does not come naturally to our species? What if we could banish the dragons from the room and say, how could we deal with this logically? Well, we've got 1.5 billion people on the planet who are currently getting nicotine by sucking smoke into their lungs, primarily cigarettes, but also biddies and Kretex. And on cigarettes alone, they're spending $800 billion US dollars equivalent per year. Most of them are already saying, I don't really like doing this. You know, there's something about early death that doesn't appeal to me. And stinking and being a social pariah doesn't help. So they're interested, and what we're seeing is ordinary people doing ordinary things. Ordinary people saying, all things considered, I'd rather not die prematurely, and I'm going to look for something else. So we're seeing millions of users of cigarettes moving to other products, trying to find other products. The reason why we now have a multi-billion-dollar market for things like electronic cigarettes. The reason why Sweden now has the lowest rate of tobacco-related deaths and disease in the Western world because of things like snus. Well, what if we supercharged that idea to say, ordinary people doing ordinary things, let's empower them? Well, look what we've done in the past with things like pharmaceutical regulation, 1938, FDA in the United States. How do you get rid of all the snake oil products, the Dr. Graham's pink pills for pale people sort of things? Well, supercharge science-based pharmaceutical products, give people truthful information about products that are actually safe and effective, give an encouragement to industry to bring forward ever new products, encourage the research and development and the investment to get those products to consumers, because ordinary people want to do ordinary things like have things that make them better rather than sick. And within 12 years, 90% of all the pharmaceutical products sold in the United States did not exist when that law was passed. That law transformed the market. Just like ordinary people didn't like ordinarily having to eat contaminated, spoiled food or highly salted, smoked, pickled food. And that's why in the 1940s, stomach cancer was the leading cause of cancer death in North America. But somebody had an intervention. They didn't have to worry about dragons. They got refrigeration. It allowed ordinary people to do the sorts of things they wanted to do, and it supercharged the idea because they get the refrigeration, they changed their dietary habits in ways they wanted to do, and consumption of those sorts of, the spoiled, the stuff that was causing the stomach cancer, declined dramatically. Stomach cancer became really rare. So what could we do if we decided to supercharge the idea of alternative nicotine? Acknowledge there's a lot of people who are not going to be able to totally quit anytime soon, just like any other sort of drug or just about any other human behavior. But if we gave an encouragement through regulatory interventions so that the less hazardous products, the less addictive products, became more readily available. We used differential taxation, so it became less expensive to buy the products that aren't going to kill you. What if we allowed that to happen, encouraged the innovation of ever better products, so we got the scientists, the researchers, the entrepreneurs, the investors behind the idea of let's replace an $800 billion market for things that don't kill people, the things that allow them to end their addiction if that's what they want to do. Imagine if we could start that happening and then have the help of people like product liability lawyers that sue the pants off anybody continuing to sell cigarettes because they're now unreasonably hazardous. And you have all those new businesses, those new entities that want to see further restrictions on cigarettes. So you get this virtual cycle. And imagine if we did that, what we'd be able to accomplish. Would we be able to do, like happened with pharmaceutical products, that within 12 years we get rid of 90% of our cigarettes? You know, maybe more? Could we possibly justify not even trying? I mean, clearly, we have an opportunity that can change human destiny, that could prevent hundreds of millions of deaths simply supercharging ordinary ideas that people are already starting to do. And if we did that, by having the dragons kicked out of the room, it's time to bring other dragons back into the room. Not the bad guy dragons, but the ones I talked about at the beginning of the talk, the dragons of power, of luck, the dragons that change human destiny, because that's what we'd be doing, and it would be amazing. Thank you.